Maybe a quick summary. What's the latest? How was your surgery? How was your week?
Okay, well, my name is Chris. 7 feet. Took him about an hour. I was quite surprised, but I've done okay. I've been feeling good the past 2 days. I've had a lot of pain the first while, a lot of soreness. But as of yesterday, I feel really, really good. And
that's why we don't have clinic any earlier.
Yeah, but now I feel really good. I've been walking around, been staying with some family, and they've been shocked, like, you've had surgery? And
but it still was rough those first couple of days.
Oh, it was really rough.
Yeah. And would you say, for people, sometimes it's hard to know what pain is and how you feel about it. Sometimes we grade the pain, with a pain of a paper cut being about a 1 and being thrown out of a building and set on fire and shot with a gun is 10. The pain that you had this past week that was very unpleasant for you was what number would you give it?
I'd say it was right pretty much in the middle, about a 5 or so.
So pretty darn uncomfortable.
Yeah, for a while. It was...
For about 3 days, did I hear you say?
Yeah.
Okay, and now you're starting to...
Yeah, now it's not. It's just a little sore when I try and move, and right. I can actually sleep now, but yeah.
So for those of you who are thinking of having surgery, we wish that we could guarantee everybody just to feel great. But remember, there are people who have complications. There are some people who go through with very little pain. There are people who do terrific, and it's just variable. And unfortunately, some people do get this kind of pain, and we're sorry about it. But on the other hand, you do look pretty perky today, and like you're bouncing back.
I've been fine. The more I walked and got around, I felt a little better. I was surprised. I've had 3 aunts and a cousin already do this, and they all told me, no pain, it was great. And so just trying to figure out what was wrong with me, but now I feel great. So,
any questions or anything we can answer for you?
I did kind of one question about the Prilosec.
Yes.
Because I've heard different times to take it. My aunts that have had it last year are still taking it, where sometimes, like in the manual, it said a couple months, and then there's only 4 refills on the bottle. So how much do you think?
I have no idea what I'm doing.
Okay.
And so we kind of say, just like we're talking about, we want you to avoid getting an ulcer. Mm-hmm. Most of our patients won't get an ulcer, and so we use it for a period of time, somewhere between 6 weeks and 6 months, or even up to a year is the right answer, but I don't know the exact right answer.
Okay.
So there's no magic answer. Some of my patients, unfortunately, will get an ulcer, and it's an awful, terrible complication. So we give it to more people who really need it to try and, because I can't identify which one's really going to get it.
Yeah. Okay.
It's a prophylaxis. It's like wearing your seatbelt. And so we tend to use it for a period of time, and I don't really have a good answer. I think you could argue that 6 weeks is good. We used to do that. We saw a few people getting ulcers in the first 6 months, so now we kind of go be somewhere between 3 and 6 months, but we've had people stay on it, and it just kind of depends. So I don't really have a good answer, and I apologize.
Well, no, that makes sense. I just wasn't sure why some of my aunts were still on it or not. So.
Okay, should we take your staples out?
Sure.
Any questions for our new post-op patient? From the patients who are pre-op?
Excuse me. You burp more after you have this.
Now that's going to be recorded on the internet, you know.
Why do some people have longer bypasses and others don't?
Well, again, in a perfect world, and I say this a lot, I have to be careful I don't get in trouble, but I think God, when He created heaven and earth, could have put little markers on the gut for me. In other words, what I'd like, applause. What I would like is if God had marked out some way of knowing if I bypass 5 feet, how much weight would be lost. Unfortunately, I don't know that. There's no marker in there. When we go to do your surgery,